Over the last 3 decades, the HIV/AIDS epidemic has impacted more than 100,000 lives. It has provoked awareness of different cultures and ethnic groups. It has inspired people to take up the mantle for justice. Right from the start, the Brooklyn AIDS Task Force became the pivotal voice to many affected by the epidemic. And the Brooklyn AIDS Task Force was at the forefront of change. Gentrification has changed the face of Brooklyn. However, the fervor to continue the fight for justice and equality remains the focal point for what is now called Bridging Access to Care. At the same time, the agency has adapted to the new world. It has broadened its services to serve a more diverse population. As Bridging Access to Care expands its reach, it also has heightened awareness about the epidemic. There is no one-size-fits-all service for Bridging Access to Care clients, and at the same time, we understand each client is unique. Today, Bridging Access to Care offers services that include health homes, prevention and education, HIV counseling and testing, a 340B pharmacy, mental health services, harm reduction, relapse prevention, and housing placement. Bridging Access to Care makes their presence known in the community with outreach workers, care managers, and HIV testing on a mobile van. Our staff hear firsthand the issues that confront our clients and the Brooklyn community daily. We educate people not only about HIV/AIDS, but about other illnesses such as heart disease, diabetes, hypertension, and other STDs. We address the issue of trauma, which along with health issues affects many of our clients. The journey for people living with HIV/AIDS can be arduous, but armed with the knowledge and the confidence that Bridging Access to Care provides, nothing can slow our clients' progress. I invite you to join us in this safe haven we call Bridging Access to Care.
Make sure that one, we are providing excellent care, that we are addressing the patient as a whole, that we're doing all that we can do with boots on the ground to make sure that we don't go backwards in terms of where we were 30 years ago, but going forward that we'll have an excellent model of HIV/AIDS care.
One thing I want to make clear and want to make sure that BAC does not lose the passion for the work and for the community that we serve. And whichever way we go as far as adding on to our venue of working with other healthcare issues, keep the passion at our focal point.